All right, Dr. Weiler, we know every year there are trends in fashion, makeup, home decor, but it exists in plastic surgery too.
Absolutely.
All right, before we get into your predictions, how does one even come to a conclusion of these are going to be the trends?
So, as a plastic surgeon, you have to pay attention, right? So you have to pay attention to fashion, social media.
Yep.
Also, we have journals, sort of medical journals that come out that are pushing new procedures.
Okay.
We go to meetings a couple times a year. It's a lonely job. Here, you're by yourself in an office and working all day.
Yeah.
So I like to get out. There'll be an event in Miami, Las Vegas, visit with my fellow plastic surgeons, and that's where all the new devices and trends come out.
All right, so talk to me about your first prediction of this is going to be a hot aesthetic trend.
Yes, so BBL. So I tell ladies, BBL, Brazilian butt lift, has been around for years, right? Kardashians and some of those ladies, right? And it's really gotten a bad name. It's gotten this, sort of, people think it's going to be a giant rear end, right?
That's been the trend, right? Okay.
But what I tell ladies is these days what we're doing is it's treated more like a filler. And so as we age, right, it's very common in ladies, fillers in the face, Juvederm, Restylane, right?
Yes.
You lose volume.
Yeah.
I always say a young woman has fat, but the fat's in the right place.
Yeah.
It's in her cheeks, her lips, her breasts, and her butt.
Yeah.
As a woman ages and a man, it goes from the face to the neck, breast to the belly, and butt to the thighs, right?
It's so funny.
Right. No, it is.
So much to look forward to.
I know, it's all falling. All right, so I tell ladies, so, we've had fillers for years, right?
Yeah.
And it works. They're very, very effective. But fillers are too expensive to put into the rear because it's a lot larger volume, right?
I just think of that little needle. It's
exactly.
going to be a lot.
It's going to be a lot of work there, right? So what we do is BBL is transforming. So it used to be for just pure size, and now we're doing it for really shape and restore the volume. So after after childbirth, or as you get older and maintaining a thin, healthy lifestyle, you lose the volume where you want it. So we take that fat from the midsection and we put it back into the rear, and we're not just making it big. We can do that if you want, but what we're doing is we're shaping it up. We're making it look perky again. We're filling back out your jeans again.
Just a little bit.
Just a little bit.
And then when that happens, Dr. Weiler, is this sort of, this will last like filler, a year, 2 years?
So fat is a very long-lasting option.
Okay.
Not forever. Nothing is forever, but we're talking 10, 15, 20 years as you age.
Okay. So
really changes your shape. Absolutely.
Okay.
Absolutely.
All right. That's great. All right. Give me two. Number two on the
Number
list.
2 is my baby, Ellacor.
Ellacor.
Yes.
Okay.
So we are one of the only facilities in the country to have it. It's a brand new device. It is going to be the hottest device of 2023.
What does Ellacor do? How does it help?
So we are moving beyond the promise of skin tightening. Okay, it is tightening the skin, but we are actually removing skin with this device.
First tell me where are the areas?
So primarily right now, FDA approval for the mid-face, okay? But we're moving all over. Belly, knees, anywhere you want that skin removed.
Okay, so you're removing skin. Talk to me about how the device works.
So
I know you're excited about this one.
Yeah, it's an amazing, simple concept, right?
Okay.
So I don't know why I didn't think of this myself, but I wish I did. But what it is it's a series of hollow core needles.
Okay.
It's a series of 3. Think of it almost like a sewing machine.
Okay.
It's punching out a small circle of skin, and it's sucking that skin out through a little tube, okay? And then it goes back in and punches another one. It's doing thousands of these little holes.
Okay.
If you add up thousands of small little skin punches, it adds up to a fairly decent sized amount of skin.
Once the skin's removed, what happens to what's left?
So those holes, we can't be left with a bunch of holes, right?
No, we do not want that.
So your skin or your body has these little cells. They act like little muscles, and they hold that skin to close it back together.
Okay.
So not only are we removing skin, but those holes are closed, and the overall skin is in addition tightened. Simple concept, and it really has an amazing results.
Are you looking at this as something pre-facelift or as an option?
So primarily our goal is, what I think the indication is right now, it's going to be for our 30 to 50-year-old ladies that want to avoid a facelift, a more invasive surgical procedure. It's not going to replace a facelift in your 60s and 70s. It is a touch-up sort of in between for those patients, in between facelifts. But we're also using it on other parts of the body. So ladies after pregnancy have a little bit of excess skin above the belly button. If you've maintained your good shape, we can treat that. Ladies come in and they say, I don't like the little crepiness and the excess skin above my knees, right? But you can't remove that without a scar in the past. This is a scarless skin removal device.
That's huge.
Yeah, it's really an amazing concept, and it's really, I think it's going to bring us to a whole next level in terms of minimally invasive procedures to remove excess skin.
So I'm curious, one more question about that. Once you have that area treated, how many times do you have to treat it? And then what's the length of those results? Because that sounds amazing with...
So good question. So typically we're recommending right now 2 treatments right now. Obviously, the more you treat, the more skin you remove, the better it's going to look. So some patients may need more, and we'll try to be as honest as we can. New device, new technology, so we're really sort of learning as we go. We like right now our fairer skin types, but we are using it on darker skin. We just have to make sure you don't scar very heavily. Procedure takes about an hour to hour and a half. Recovery is anywhere between 3 to 5 days.
And then how long can results last? Or what
so, I always tell patients we can't stop the aging process.
Unfortunately.
But
otherwise
you'd
be...
Exactly. I'd be a very wealthy man, and we'd all be looking like we're 20 right now, right? But I do tell patients we can reset. So we bring you back, right? And then we reset and the aging process starts again. So this is a device that you can use, a series of 2, 3, even 4 treatments. Let your body heal, see where it goes, and then a few years later you can do it again. So it's a device that is trying to push off more major procedures. It's not going to necessarily replace those, but it's going to allow patients to look better in between and push those things off.
It's a great option. I love that. That's going to be big. I'm with you on that one, Dr. Weiler. Okay, and then finally number 3.
Yes, hormone replacement. Okay, hormone replacement has been out there. It's been in the background for years, a little controversial. It's really starting to become a lot more mainstream. So, plastic surgery, in my opinion, over the last 10 to 5 years, really throughout the pandemic has become just more and more popular, and more accepted, right? Patients, you ask your friend, hey, where do you get your Botox? And it used to whispers of, does she have Botox? It's not, are you getting it? It's where are you getting it, right?
It's your outfit's cute. Where'd you get that? And what did you do?
What did you do, right? So it's accepted these days, which is great, and it's not going away. So, hormone replacement is really starting to become mainstream too.
Tell me how and what. What are we looking at?
What I tell ladies is, and men, so both populations, you have, really significant hormone changes in your late mid-40s. And so, I tell both ladies and men, if not only we can help you look better, but if you want to feel better, you need to replace those hormones.
Internal and external.
Internal, right? And then there's also a whole new type of medication called the semaglutide.
All right, what is this?
This
is a buzzword right now.
So yes, it is a buzzword. You've probably read about it, heard about it. The Kardashians have been accused of being on it. And what it is, it's a weight loss. It's not a weight loss medication. It's a diabetes or a pre-diabetes medication. And it's a medication that's meant to be taken almost lifetime.
Really?
It's a medication that's very, very safe. But what it does, it's not indicated for weight loss. It's indicated for balancing your insulin levels. So we realized that if your insulin levels are consistent, you don't want these giant spikes.
Right.
So, you go eat a big king cake season, right? And your sugar spikes way high, right? And that causes you to feel bad and crave even more. So we've learned if you can manage your insulin levels at a very consistent level, it takes away those cravings that we've developed. Our bodies aren't meant to have this amount of sugar being ingested and have these wild swings. So we've learned this medication manages your insulin levels, which is wonderful because it makes you a healthier person. You'll live longer. Oh, and by the way, because of that, your cravings are going away and you're losing weight. Significant weight. When I tell ladies that are on it and men, 30%, not 30 pounds, 30% of your body weight.
30%.
Which is equivalent to a gastric bypass.
Oh my gosh.
So I'm a huge fan of gastric bypasses for certain patients. They're very safe these days and very effective. But this medication is being shown to be as effective as that. And it's applicable across all age ranges, and it's a very, very safe medication. It's not the medications of old like phentermine, which is a speed, right? It makes you feel funny, sweat, it's burning off that stuff, right? Those medications you do short pulses and cannot stay on them. This is a medication that's very safe. It works with your body. It's meant to be long-term, and it's really amazing.
This feels revolutionary, Dr.
It really
Weiler.
is.
Is there an ideal patient this is not for the patient that's looking to lose 5 pounds. Is this for significantly overweight, or does it matter?
So the medication is titrated. So
what does that mean?
Which means, I'm getting medical on you, which means that some patients need just a little. Some patients need a whole lot, depending on your body and your natural insulin level. So, if you're
makeup.
right, PCOS, pre-diabetes, diabetes, they all require different levels. Patients that come in and want to be healthier require different levels. So, it is indicated for ladies that are maybe, let's say 15 and guys, 15, 20 pounds overweight. if you're on high blood pressure medication. And so obesity is a very, very serious epidemic.
Yeah.
And I really take a step back, and I'm sort of out of the realm of real medicine these days, as a cosmetic plastic surgeon. But I tell patients is obesity is a killer, right? You don't see a whole lot of heavy people in their 70s and 80s.
Right.
And the reason is because obesity causes a lot of issues. So obesity is an epidemic. And so I tell patients, maintaining a good BMI, a good body weight is really essential to health. And this is a medication that can be used as a tool with diet, exercise, and this medication to get you to your ideal weights.
And a lifetime of
happiness
and health and longevity.
Yeah. Some
overall.
patients just take a small, couple of months and change their life. Other patients' bodies, some patients eat really well and exercise.
But their physical makeup, genetics,
their genetics, they're going to be 30 or 40 pounds above their ideal BMI. They're eating healthy. They're doing everything they can, and they're frustrated, especially as you get older. I'm hitting 50, right? And so it's frustrating. And yeah, I know. But this is a medication that we can use as a tool to maintain a healthy body weight. And it's an amazing medication.
That's fascinating, really interesting, and great to know that it's one stop, right? You can take care of the external and also the internal.
Yeah, absolutely.
Great. Thanks so much, Dr. Weiler.
Thank you.
Appreciate it.